Hi, my name is Jose Pro, Man Survival, and I'd like to welcome you back here to the channel. And we want to give you more information of things that are going on in China. This is an update, because more things are coming out, and I want to get you guys prepared for it if it gets really bad in the United States, because we already know there's more cities in the United States that have confirmed this virus. For example, just today in California, Orange County, California, confirmed a case. And even though they call it low risk of spreading, either way, low risk is enough for me to be prepared. I hope it's the same for you guys. I have a few articles here, okay? And this shows you real time what happens during a disaster. This is the reason why you cannot wait for something to happen for you to be prepared, okay? I'm going to give you the headlines and then I'm going to read the articles. This one's from BBC.com. Wuhan coronavirus lockdown. We got enough food to last 10 days. Wuhan residents scrambled to leave virus-hit cities as shelves empty. This from RFA.org. Asia panics. Virus masks sell out as price skyrocket amid coronavirus fears. From Zero Hedge. Okay. Excuse me. So what do we see? As you're going to see in these articles, is that things sell out very quickly. People buy in a panic. And stuff gets very, very expensive very, very quickly. Okay, that's the things we're going to see. The stuff runs out. People panic, buy in a panic, and everything skyrockets in price. This is the reason why you need to be prepared before something happens, because you can, for one, save money. Two, you'll have a cooler head and you'll know what you need and what you're gonna get, and your family what they need. And three, you don't put yourself in harm's way to try to fight everyone else that's trying to get the supplies that you also need. This is why you need to go ahead and have it in place. Okay. We're gonna start with the BBC report. Okay, Wuhan coronavirus lockdown. We got 10 days. We got enough food to last 10 days. A Chinese student from Wuhan who wishes to remain anonymous is staying off the streets, hidden away with his family, as he should. Okay, and you're gonna see that this student's plan was to bug in. All of my family are staying indoors. My mother went to the supermarket yesterday and the shelves were empty. Got enough food and water to last us 10 days, but after that, we don't know what will happen. He added that he knew the virus a month before official announcement. Makes you wonder how. I told my family to buy food and masks, so we've been well prepared. A friend of his, however, has not had the mask he ordered arrive because the road's being blocked. And we know that the Chinese government sent the army and they blocked the roads with dirt. Okay. A week ago, I went to the hospital in Wuhan to pick up my prescription. There were not many people were wearing masks then. Luckily, my family are all fine and we've been checking our temperatures daily. But can we really celebrate Chinese New Year of all this going on? And of course the answer is no, because you can't go anywhere. But we see that he knew about what was going to happen a month before it did. He told his parents to get supplies, and they got enough to last 10 days. And he said they didn't know what they were going to do after that. Okay, of course the Chinese government is going to set up some kind of supply chain, to come in and out of Wuhan, because they have 13 cities quarantine, a total of 50 million people. If they just don't resupply those cities, it's gonna be chaotic. Okay, people will run out of their stocks, whatever they were able to fight, to get, and then they're gonna have to go back out and try to find something to eat. So if they don't have the logistics in place to be able to resupply all the stores or whatever it may be, then they will have a bigger problem in their hands. Okay, Wuhan residents scrambled to leave virus-hit cities as shelves empty. from the RFA.org. And another article that I've read today is that they believe, I think it was 5 million people or 5,000 people. I gotta go back. I'll leave it in the comments. Can't remember. I didn't bring it out and write it down. But the point is that all those people left the city of Wuhan before the quarantine was established and enforced. Because we know that when they came in, nobody can get in, nobody can get out. And the people that do try to escape, if they get caught, they'll be shot in the spot. So they can't go anywhere. Right? But the ones that did leave, they left, they got on an airplane and went somewhere else. We don't know where. And we do know there were also reports that airplanes were diverted coming to the United States to treat some people. So we know it's here, apart from all the other cities. Panic buying was visible at gas stations, supermarkets, and fresh vegetable markets as people tried to stockpile food and daily necessities, unsure of when supplies would be restocked. Private cars are rushing to fill up gas, and the prices in the supermarket have skyrocketed. A resident surnamed Liu said, garlic shoots usually sell for a few yen per pound, but the price of the supermarket is now 80 yen a pound, he said. There's a supermarket in our office building, but everything in it is gone. An employee who answered the phone at the supermarket in Wuhan said that they had sold out of surgical masks and disinfectant on Thursday and confirmed the prices were rising. Prices have risen in line with market economics. The market are selling for 10 times their previous price, the employee said. They used to sell for 10 yen a pack, but now they are selling for 70, 80, 100 yen a pack. Okay, so we see inflation hit very quickly. And of course, demand and supply. But the point is that people were out there fighting. They were panic buying. And they were trying to get their hands on everything they could before everything ran out. Now, I haven't seen any reports of anyone being injured or anything like that, but I did hear of people that were buying stuff, and when they were walking home, they were getting robbed. So at least that is happening too. Asia panics. Virus masks sell out as prices skyrocket amid coronavirus fears. Okay. We mentioned on Thursday how worldwide internet searches volume for virus masks had erupted this week as the spread of coronavirus becomes uncontrollable across Asia. The World Health Organization has yet to declare an international virus alarm as the evolution of the epidemic broadens. News reports suggest virus masks and hand sanitizer are in short supply in some regions of Asia. Reported the South China Morning Post. Pharmacies across Hong Kong on Friday afternoon sold out of the masks and prevented the wearer from contracting the virus. The most popular respirator is the 3M N95 medical mask that has sold out in many pharmacies across Hong Kong. Any remaining N95 masks have been sold for as much as 60 Hong Kong dollars, which for United States would be $7.75 per unit. A massive plus 700% mark, considering the masks usually sell for less than Hong Kong $7.77, which is about $1 here. Okay, so there we go. We see that prices have skyrocketed. If these people would have been prepared before something like that happened, they would have gotten their stuff cheap or regular price, but now they have to pay 10 times more. Okay, excuse me. Taiwan this week banned the export of masks for the next month while the government stockpiles reserves. Okay, we know that there's cases in Taiwan that are happening, and they're not stupid. They're getting ready for it, and that's why they're banning the export. Okay, that's gonna make other people, like in China that need the mask, they won't be able to get it if they in fact get it from them. But the point is, the Taiwan government is getting ready. Across Macau, residents have been hit with mask rations. Only 10 per customer is allowed who can present pharmacy with a valid government ID. And that is very important and very, very telling, because only 10 per customer. Now, I don't know if, the reason being that it's you need more than one mask is because those masks only last you so long. For example, the N95 continuous use can only last you about 8 hours. Okay, so of course you need more than one mask if you're gonna wear them 24/7. I guess it depends where you are and how often you need it. Okay. Now imagine, I don't know if more members of the family are involved in it and they also go get their 10. But the point is that if you have a lot of people in your family and you're the only one that's able to get them because everybody else don't have a valid government ID, then they're pretty much screwed. Okay. So the point is, you have to be ready before things happen. Now, how bad has things been in China? I mean, I'm sure you've seen all the videos. It's everywhere. Okay, now with social media, you can see stuff in seconds. Infected people seen there in the streets of quarantine China's coronavirus city, Wuhan. Okay, Wuhan has been branded as zombie land by frantic locals after Chinese authorities told residents they are not allowed to leave yesterday morning. Okay, we're gonna show one of those clips right here of those people that unfortunately are infected and they are dying in the street. That's very sad, and you know, people like that. It's just sad. I mean, what else can you say? It's very unfortunate. Here we have another video. Here's the headline: Chinese doctor cries, begs for help treating coronavirus as hospitals run out of beds. This from nationalrifle.com, and we're gonna show that video right now.
你们做了什么？你们做了什么？你们5个只是看了800个病，还他妈1天4个班，还把我们除了8个门诊是3班，我们不想活。你自己看，你们到底想干什么？你们啊！我不要命！你把那些病人都搞走，躺在地上那个拿走。 痛不痛啊？你不跟院长说不要干了，你们给搞得这么免了，算了，叫我滚蛋，回家！不然跟我这样说。我没有闹。这病躺那么多怎么办？
叫他们院长过来看看。
院长谁过来？
你说让病人去跟。
没有，我去了。
走到台了。
啊？ 我不知道哪个是院长，我去了，我连1、2、3、4、5、4长热线都打了。
不要医生，我不要医生，我有医生，我打死人家，我能看。
All right, it says disturbing video footage posted on YouTube shows Chinese doctor in the city of Wuhan begging in vain for help from the higher ups to combat the spread of the deadly virus, or the deadly coronavirus. The doctor, clad in full hazmat gear, is seen on the phone communicating with his superiors in an agitated voice. And here's a translation of that conversation. He's on the phone. He says, "I don't want to go home. I don't want to go home to celebrate New Year's. Huh? What do you guys do? What do you guys do? You 5 went to see some sick people, and then there were 4. And then when we came out, there were 13. We don't want to leave. Look at the situation." The doctor continues. "What exactly is it that you guys want to do, huh? No, I don't want to wait. I don't want it. Fine. If you guys don't think it's convenient, then forget it. Take them away. Go home. Go home and don't work." The nurse at that point comes in and says, "Don't make a fuss." The doctor says, "I'm not making a fuss. There are so many sick beds. What do we do?" See, I mean, he has no idea. And we're about to show you another clip of people just lying there, waiting in very long lines and dying, waiting to see the doctor. And if you were in that situation where you went and you saw that the emergency room was that packed and people lying dead on the floor, I mean, you know, you're gonna pretty much lose all hope. Okay, This is why you gotta be prepared. We're about to show that video right now.
3具尸体已经在这里躺了一个上午了，有的人已经是凌晨死的，到现在没有人来处理。然后医生、护士还有病人全部都在这种环境下面工作。这就是定点医院的现状，没有任何人管。刚刚找领导，没有领导，领导也解决不了。要怎么走啊？
All right. Doctor at Wuhan hospital dies as coronavirus outbreak spreads. This is from WSJ.com. And that is very unfortunate. I don't know if this is the same doctor which you saw on the video. But the point is that this a doctor who worked at the hospital in Wuhan, China, where coronavirus patients are being treated, died Saturday morning, while a 2-year-old Chinese girl became the youngest patient to date to While a 2-year-old Chinese girl became the youngest patient to date in a rapidly spreading outbreak that authorities are struggling to contain. And that is very sad. Now, that's how fast this thing is going. If this doctor got infected with that virus and he kept working, now that's a hero right there. But the point is that this is very deadly. It's only been, about a week since this thing came out. And even the doctors are dying, okay? The nurses, there's more videos out there showing that the nurses are afraid to take off their gear, or they even take off their mask to eat, to use the restroom, whatever the case may be. And also, now we know that the virus spreading through the eyes, okay? So the point is, you gotta be ready for something like this, and this is obviously very important and very serious. So I'm gonna close with how to be prepared for this, okay? And this I've shared this list in the previous 2 videos, but it's still the same. Use face masks and use gloves. Avoid touching your eyes, your nose, and your mouth. Have an adequate supply of tissue, soap, paper towels, alcohol-based hand rubs, and disposable wipes. Stay home when sick, covering coughs and sneezes with tissue, washing hands often, and clean frequently touch surfaces and objects, because you don't want to get other people sick, or you don't want to get their sickness. Use face masks when sick and in close contact with other people. Keep children from child care facilities and school, and increase the space between people and decrease their frequency of contact with other people. Okay? In other words, quarantine yourself. And on this list where I said avoid touching your eyes, your nose, have an adequate supply of tissue, soap, paper towels, alcohol-based hand rubs, and disposable wipes, add the eye protection, because it's going to be very, very important, because now we know that it's going through your eyes. Now, in other words, cover every hole you have so nothing gets in and gets you infected, okay? So the point is, get prepared, and get prepared today, because we know there is a confirmed case in California, confirmed cases in Chicago. There was a scare in Tennessee. I don't know if Texas ever got cleared from that, the one that they were suspecting, and I know Washington State was the very first one to get it. So it's in the United States, and as I said, they're diverting planes to come to the U.S. so they can treat people. So the point is, it's here. It's in the United States. It's in our backyard. It's just a matter of time before they tell us that it has spread very widely and starts to sell out here too, and people buy in a panic. Don't be those people. You still have time right now. Get ready for it. As always, we tell you to be prepared, be ready, and I want to thank everyone that has subscribed to the channel. Thank you so much. I greatly appreciate it, and everybody that has left a comment, I have answered every one of you, and if I haven't answered you yet, just give me time and I'll get to you. Thank you guys for everything that you do. Please like and share this video also, and we're on Facebook as well. Please like us there too. And again, always be ready.